Hello, I'm Amanda and I'm going to perform an abdominal assessment. This entails the abdomen, the organs, and the large vessels. Let's get started. Good morning, I'm Amanda and I'm going to be performing an abdominal assessment on you. At this point, I will make sure the patient has emptied their bladder as to prevent any distension. I will help them lay in a comfortable position, and I would be performing the assessment against bare skin with no clothing or drape in the way. As the assessment progresses, it will be performed from the least invasive to the most invasive. This would proceed with inspection, auscultation, palpation, and percussion. Some common abnormal findings would be edema, any pain, swelling, masses, or pulsations. The first part of the assessment, I'm going to inspect the skin. I'm going to be looking for any yellowing, any redness that could be inflammation. I'm going to see if the skin is tight, which could be ascites, any dilated veins or spider angiomas. I'm going to check for any wounds, any scarring, and I will ask the patient how they received these wounds. I'll be looking for rashes. I'll be checking out her moles. Are the moles bleeding? What size are the moles? The symmetry of them, the color, and I'll look around the umbilicus for the Cullen sign. That could be indicative of abdominal bleeding or internal bleeding. I'll look for contour and symmetry and distension of the abdomen. I'll look for any herniation. I could have her lift up her head, lift your head up, and then herniation could protrude. All right, you can put your head back down. I will measure her abdominal girth, and just have like a baseline of the abdominal girth. I'll notice that the abdomen is flat or round. Also, as the patient breathes, I will see what type of breathing pattern she has, if it's thoracic breathing or abdominal breathing, or if she has diminished breathing. I will look for any aortic pulsations. If there's a slight pulsation, that's normal. If it's exaggerated, that is not normal. Lastly, I will look for peristaltic waves. If they're exaggerated waves, that is abnormal. All right, next I'm going to auscultate the abdomen. Abnormalities would be hyper or hypoactive bowel sounds. To declare hypoactive bowel sounds, I would listen for a total of 5 minutes. Bowel sounds should occur about every 5 to 15 seconds. And with this, I would listen for bowel sounds in every quadrant. So going in clockwise with right upper, left upper, left lower, and right lower. Next, I would auscultate vascular sounds, and this would be listening at the abdominal aorta, the renal arteries, the iliac, and the femoral arteries. This will check blood flow to the lower extremities. I'd also be listening for bruits. That would be an abnormality. Next, I'll auscultate for the venous hum. I'll do this with the bell of the stethoscope, and I'll listen at the epigastric area and umbilical area. Lastly, I will listen for a friction rub above the liver, around the liver area, and that's about the 12th rib on the right side. And then I will listen above the spleen, about the 10th rib, and listen for a friction rub above the spleen as the patient breathes. Next, I'm going to be performing percussion, and like with auscultation, I'm going to percuss in all 4 quadrants. Percussion is performed by placing the hand over the area I want to percuss, spreading my fingers, and then tapping over my pointer finger. So I'm percussing for tone in all 4 quadrants. I'm listening for tympany and resonance, and seeing if there's gas in any of the quadrants. Some abnormalities would be hearing dullness over the spleen or the liver. I'd be hearing noises if it's distended or there's a mass. I'd be hearing dullness. Next, I'm going to percuss the span and height of the liver. This is going to be on the right side, so I'm going to percuss all around the borders of the liver, hitting, listening for that dullness. Then I will do the same thing to percuss the spleen, finding those borders. And then lastly, I will perform blunt percussion, and that's going to be where I'm looking for tenderness or pain in the patient. So I'm not going to palpate deep, I'm just going to tap and then see if the patient reacts. So I would do that on the back where the kidneys are located to do blunt percussion for the kidneys, and I'd also do blunt percussion for the liver. A little demo for blunt percussion. This will be doing blunt percussion for the kidneys. You'll place your hand flat on the patient's back and then hit pinky side down. And so that's blunt percussion, and with that, you are just looking for any pain or a patient's reaction when you're doing that to the kidney or the liver. The last part of the assessment I will perform is palpation. First, I will start with light palpation, and I will check for involuntary reflex guarding or any abdominal rigidity, and I will check in all 4 quadrants. During palpation, I will deep palpate, checking for masses. If there's a mass, I want to note the size, the location, the consistency, any tenderness that it's causing to the patient, and the mobility of the mass. I would also palpate the umbilicus and the abdominal area, further checking for more tenderness. I would palpate the aorta. I would assess the pulsation and see how wide the abdominal aorta is. If it's abnormalities, would be if the abdominal aorta is wide and if there's a bounding pulse. If there's a prominent mass above the umbilicus, this could indicate an aneurysm. I would palpate along the liver. This is along the right costal margin, and so with this, I would place my hand along the right costal margin and ask the patient to take a breath for me. And then I would push in, and I could notice if the liver, you can breathe out. I would notice if there's any hardness or if the liver is enlarged or if there's any tenderness. Next, I would do this with the spleen. I would go along the left costal margin. I would place my hand and have the patient breathe in. And with the breath, I would push my fingers in, looking for the same things, such as enlargement and any tenderness. This will conclude my abdominal assessment. I thank you for your time, and I'd like to thank my very compliant patient for being in my video.